good evening, good afternoon from wherever you're watching me from. This is African Rose coming to you live from Africa, and I want to welcome our new viewers and to our new subscribers. Thank you very much for joining us. In our episode this morning, we are in a continuation with our previous discussion with our renowned psychologist, Dr. Nelly Otieno Kitura. And we are in the mental health episode where we discussed various issues on mental health. And today, Dr. Nelly, thank you very much for joining us once more. Could you kindly take us through as we discuss this topic on mental health and in specific, depression? Thank you, Dr. What is depression?
Thank you very much, Rose, for another opportunity to just share on this topic. Depression is actually a mental illness, and it actually affects a lot of people. Millions of people suffer from depression, knowingly, some of them even unknowingly. And it's actually characterized by like loss of interest on things that somebody's loved so much. For example, you'd find a person that loved to sing and dance. When depression comes in, they totally just lose it. And whether there's music playing or is a song they loved, it's just actually not of interest anymore. It also happens that in an individual just becomes really, really sad, even at reasons you don't even understand. One wakes up in the morning and there's so much sadness in one's life that they cannot understand. And then also things like hopelessness. You wake up in the morning and somebody that was so busy and so active and always having things to run with, suddenly they become so hopeless and nothing just matters anymore. This is exactly what depression is.
Okay. Thank you for telling us, taking us through what depression is. And there are various types of depression. And could you kindly tell us the types of depression? You know, one might be having depression and does not know. So what are the types of depression?
Yeah, some of them, I would literally mention like about 4. And one is a major depressive disorder. And this is very, very common. And it's that's why the sadness comes in, the hopelessness. Yeah, so that is one of them. And then also we have the seasonal affective disorder. And then we also have things like postpartum depression. And then things like bipolar disorder. So those are some of the types of depression that we commonly see.
Okay.
Right.
There are always, thank you for letting us know the types of depressions. And what are the symptoms? How can our viewers, or how can somebody know that these are the symptoms of depression?
Rose, is very important for especially an individual, people to know the symptoms of depression, because many times the depressed person doesn't even feel it. Neither do they even see or even get to know what it is. For example, when you're talking about a symptom like somebody who was alive and very happy, jolly, outgoing, suddenly just becomes sad and feels so hopeless. Sometimes in their own lives they don't even see this. And now you as an outsider, as a friend or as family or as people that know them, when you see this kind of sadness in their lives,
right,
it makes you begin to think, because of a period of time you can actually be able to tell. And then also they will not stop enjoying some of the things that they did. They loved cooking, going out, and then suddenly they just want to stay indoors. They do not want to do those things that actually kept them busy. It's also good to look out for some of those. Being easily irritated at even things that you don't expect. You just mention something or something that is not even related to them, and it will really irritate them and throw them off balance. Those are some of the signs that we need to look out for. And then also lack of sleep, insomnia. Depression can actually deny one total sleep. They try everything and it just doesn't work. So those are some of the things that you need to look out for. For example, and some people, that never used to have a large appetite, they begin to eat until you're asking what could be. I mean, what is not happening?
Yeah.
So they eat a lot. And also when you talk about sleep, for some people it's lack of sleep, but for others, it's actually they just want to sleep all the time. Anywhere they sit before long, they've actually knocked off and gone, you know. So those are some of the things that we look out for in terms of symptoms. And low energy is also one of them. One can just get very tired at no apparent reason. They've really done nothing, but you just feel like your energy is totally gone. Those are some of the signs that you also need to look out for. Lack of concentration. Yeah, because your mind is just wandering and going from place to place. Depression does that to somebody. Also, experiencing physical issues, you know. Yeah, those are some of the things that physically things are not. For example, one person that used to dress really nice, then suddenly they wake up and that is nothing. They don't want to dress up anymore. Even taking a shower is a problem. Brushing their teeth is a problem. Combing of hair is really a huge problem, you know. So those are some of the things that we need to look out for. And also self-harm. Some of them would literally want to harm themselves at all times. So you know, any time that they're seeing anything can looks like it's something that can help them get to where they want to go. Even a glass like this can actually become, you know, a tool for them to harm themselves. So these are some of the symptoms that depression brings, and we need to look out for them.
It's interesting. You've actually told us the signs and the symptoms, and you've mentioned insomnia. One would want to just sleep. You've also mentioned the eating part of it, where someone will just want to eat and eat. Thank you for enlightening us for that now. Okay, on another question, what triggers depression?
Well, Rose, the triggers are so many. For example, genetical issues can actually be a cause. And then, if you look back, if you check on an individual's history, you could find maybe there was a grandfather or a grandmother or one of the relatives, and it could actually date really back that has that. And also within that generation, if you check properly, you could find maybe they have a cousin or some relationship that also has issues to do with depression. So that could be one of them. And then life events can also can be a trigger to depression. You look at things like broken relationships, marriages, illnesses within the family, that could maybe be a close relative that one is taking care of or concerned about. So those are some of the things. Loss of jobs can actually bring depression. Yeah, so some of those life events can actually be able to trigger that. And then not just that. Also, if you look at like when we're looking about talking about loss, loss is really wide. It could be loss of a job, it could be loss of an income, loss of a close relationship. That can actually be a trigger to that. And then, like I said, also having family history could be one of them. And traumatic life events, that, for example, an accident. And within the accident is maybe somebody has actually lost a part of a limb, or it's a long term kind of trying to recover from maybe some injuries that took place. Yeah, so those are some of the things that can also be able to bring that. And then we are also looking at the brain chemistry. Sometimes something just goes wrong and can also actually trigger depression, amongst the many things. Yeah, so a chronic stress, stress that keeps coming, and this thing, you're not able to deal with it, it goes and comes back. And that is really, really, really common when we're talking about depression. Yes.
Okay. I know the triggers will be quite a number, which I know will, as we continue with this mental health discussion, we'll continue talking and touching on them. Now, just as we continue with the same, how is depression diagnosed, and how can it be treated at the same time?
Okay.
Once you diagnose it, and then how can it be treated?
Yeah. Once you've seen the signs that we've talked about, and then the best thing is to seek for therapy, and the treatment the treating depression normally would combine with maybe a combination of therapies and medication. Yes. So this requires for somebody to be able to visit a health facility, talk to therapists who are actually qualified, because then they'd be able to know whether just a talk therapy can be able to help, or they need some medication, because some of it, when it's so advanced, it would require actually some medication, because you realize sometimes you talk to somebody and then they go back home, they're not able to sleep. So what happens? Such a person would require some medication to calm them down, so that they can, this talk therapy can actually be able to effectively take place and help the person. Yeah, so it's a combination of therapy and also medication that helps in most of the times.
Okay.
Yeah.
It's quite interesting, viewers. It's quite interesting, and there are many people who are living with depression, and how would you advise someone, or our viewers who are watching us right now, how can someone live with depression?
Well, Rose, depression can be really challenging, very, very challenging. Because, and you'll also realize that a number of times the depressed person, like I said, does not even know that they're depressed.
Yeah.
So until they reach that level of acceptance that they now know something is not very right. And so what one needs to do, they need to manage their symptoms, because if you're not able to manage it, it can actually override. And this can be done by regular exercises. And we have very, very many exercises that when they visit maybe a facility or talk to a therapist, they can be taken through. Some of the exercises that can actually be beneficial, because we also know age and health, not every exercise works for everybody.
Right.
So once a therapist has helped them to identify where they are, they'll also be supported by knowing what exercises are actually best for them and can work for them. Another thing is having a healthy diet, because some of the diets that we are on can actually just escalate the whole thing, like things to do with like sugar. Diets that are full of sugar, something exactly can actually escalate, make one go hyper, and all those kind of things. So a healthy diet is also very, very important. And when you go to a health facility like ours, then you are able to get a nutritionist that can actually be able to identify and put one in the right diet. Another thing is getting enough sleep. Everybody who is going through depression requires a lot of mental help. So sleep is one of the therapies that are very, very, very important. And sleep at the right time and the right amount of sleep is required, because one can sleep 24/7, and that will just actually throw one off balance again. So advice on when to sleep and when not to sleep, and when one is not asleep, what else can they be able to do? That can also help improve their mood and also overall well-being. It's also important that these individuals get a lot of support from family and friends. It's so important, because loneliness can also escalate this. So having friends that mean well is also very, very key. And then they can also, being resourceful. There are other things. For example, like for us, what would advocate for is also having a lot of occupational therapy for them. Things that they can do outside the normal other things that they do to keep them busy. You know, things like playing pool, you know, table tennis, yeah, knitting, feeding animals or birds, those kind of things, cleaning, cooking, you know, those kind of things. So literally keeping them busy occupationally is also very, very important.
Wow. It's quite encouraging, and the tips are very, very educative. Yeah, one should at least do some exercise, eat healthy, dance around, as we heard from Dr. Otieno. And as we conclude this, how can we break the stigma of depression?
Well, yeah, there's so much stigma. Because, you know, I was just following up on a few issues that have been happening in our country. And one of them, we know the case that we had in Kitengela. And there's so much stigma around this. We forgetting that depression is actually a disease. In fact, one of the comments I was reading was that people are hiding behind depression to just be murderers. Which I don't think is true. So literally what needs to be done, a lot of awareness needs to be created, especially to the public, to understand the, you know, what depression is, the levels of depression, the symptoms to look out for, and then to be able to give people support. And this you can only do when we also begin to empathize with them, you know, and not showing sympathy or you know, treating them the way we are. So empathizing with them is very, very important. Once awareness, and this awareness need to be created to the public, because if you have one or two people understanding what it is, does not help. But if the public know exactly what depression is all about, then they'll be looking out. When they see things happening, you look out to the symptoms, to know also the levels where this person has reached, and then knowing also where to refer these people to, that kind of support. So, and then making for example, advocating for better health services for this kind of people is also very, very important. Because do people even know, if I'm going through this thing, whom can I see, where can I go, you know? Yeah, so stigmatization has actually brought a lot of problems, that even if I'm suffering from this, even if I've already identified that I'm depressed, but what will the whole world think of me? Are they going to take me? How am I going to be treated? So you see, if we all can work together at awareness being created, people being empathetic to what others are going through, and then knowing, if I know you as a friend, for example, and then I've seen the symptoms, where do I refer you to? And are these facilities available? And if they are they also affordable for one to be able to access them? So those are some of the things that we actually need to look into. Yeah.
Thank you very much, our viewers, for listening, watching African Rose. We've gone through the different types of depression, the causes, and how to handle depression. We'll continue in our next episode on depression. We welcome you. Thank you. Bye.